I made a 4-part series on pandemics in 1990, which was based on the fact that people were thinking that HIV was the first new virus to ever hit humankind. And anybody who knew anything knew it wasn't the first new virus, and it certainly wasn't going to be the last. And I made a 4-part series. And we interviewed Michael then, because Michael had elucidated possibly the cause of the Athenian plague, which was well described by Thucydides, and has had a huge interest in past pandemics, but current pandemics as well. And in November, he was appointed to Joe Biden's transition committee, COVID-19 advisory board. He's author of the best-selling book, Deadliest Enemies, or War Against Killer Germs. He's director for the Center for Infectious Disease Research and Policy at the University of Minnesota. And I asked Michael, I started the first section of my interview with Michael Osterholm is really looking at the history of pandemics, because almost the biology is almost the least important part of a pandemic. We make pandemics ourselves. Anyway, have a listen.
Well, there's actually several things that have to come together. First of all, you have to have an infectious agent that hasn't been in the population for some period of time, meaning at least generations, so that you don't have a large group of people who are immune to the particular pathogen. The second thing you have to have is a readily good means for transmitting it. Most of the pandemic agents that we think of, the viruses in particular, were ones that were transmitted via the respiratory route, meaning that it was actually very easy to move it quickly through large populations. The third thing you had to have with regard to this is the fact that it had a way to move from continent to continent. And we learned that even back in the Middle Ages that happened. And so when you put those three together and you have that ability to cause serious disease, you now have a pandemic of concern.
And where do social and political factors fit in? Because you certainly had, in the plague of Athens, you had a siege, you had warfare, you had malnutrition. With the Black Death, you had, again, warfare, environmental disruption, which created a mutation in Yersinia pestis associated with sea travel and trade. Just play in social and political factors to pandemics, the origins of pandemics.
Well, in a sense, we've created a modern world that is by far the best mixing vessel we could imagine for a pandemic. For example, just take a look at what the next influenza pandemic could very well represent. Today, we have over 23 billion chickens on the face of the earth to feed the 8 billion people. Over half of all the body weight of birds in this world are chickens. Then you add them being the source of the avian or bird viruses, and you put them close by to pigs. And we have well over 90 million pigs in the world at any one given day to, again, feed the protein needs of the 8 billion people. Oftentimes, the chickens and the pigs are co-located in such a way that the bird viruses are inhaled by the pigs, and their lungs are very unique in that they have the receptor sites with the ability to be infected by both bird viruses and human viruses. And so when an influenza virus from a bird and a human get together in the same lung cell, you have the opportunity for a new virus to spin forward to cause a pandemic. That didn't happen even 50 to 100 years ago, that kind of agriculture, that kind of concentrated human population, animal population together. Then you throw in modern transportation. And so in a sense, we've really been grooming the whole world for centuries to become better and better at creating pandemic infectious agents, and then once they're here, moving them around the world.
And if you add one more factor in, which has been this idea has been circulating with this pandemic, is our ability to manipulate viruses in the lab and through CRISPR to change their genes a lot. And one theory, less likely, is that it escaped from the virology lab of the Institute of Virology in Wuhan, where they were doing what's called gain-of-function studies on coronavirus, maybe 2 or 3 years before the pandemic, where they were studying what it would take to turn a coronavirus into a pandemic virus.
Yeah, at this point, I can't vouch for what was or wasn't going on in the Wuhan lab. There's surely lots of speculation. This has been an issue that I've been very concerned about for some time. I served almost 6 years on the National Science Advisory Board for Biosecurity in the United States, a group that was brought together to address just this very issue. And I've been very concerned, even if it was not by intentional means, that we were manipulating infectious agents with the idea of trying to understand what they did or how they did it, without realizing that accidentally you could create that kind of pandemic agent. So this is a very serious issue. Mother Nature surely, by herself, can do a wonderful job of providing us with these dangerous viruses, but humans surely can add to it. What the verdict will be ultimately for the coronavirus situation is unknown, but it's something we have to be mindful of and consider that in the future, someone could possibly create a virus like this that would be a huge challenge.
How much stirred you said by the story of the 2 Chinese scientists who've been let go from this level 4 lab in Canada, the national level 4 lab in Canada, who apparently who took henipaviruses into China, maybe other viruses as well?
You know, I hear the same things everyone else does. I don't have any magical source of information or any crystal ball. I just come back to the fact that this is a very important issue. We have to address it, and there's no perfect answer. If someone is going to do something nefarious with infectious agents, we surely could be at the risk of having a major infectious disease problem, including a potential pandemic. I think that if one goes back and looks at the 2001 anthrax attacks in the United States, I have no doubt that the individual who perpetrated that was someone from a high-security U.S. lab who had mental health issues that intentionally moved those Bacillus anthracis spores through the mail. And so we have to be mindful that this can happen.
Just before we go back to the coronavirus pandemic, what can we do to minimize the chances of that? And some people believe it may have already occurred, it's just not turned into a pandemic yet.
This is one of the challenges of modern science and the whole issue of human values. You know, we know that people do nefarious things all the time. What's more challenging now about this issue is it's gotten easier and easier for individuals to do things with infectious agents. You know, we're now doing the kinds of studies, the kinds of activities in high school microbiology labs that literally just a decade to 2 decades ago were only done in the most secure of government laboratories around the world. Now, these are not investigations or experiments that are trying to create new infectious agents or change old ones to be more infectious or more deadly. But the point of it is that the same tool today that can be used for routine science investigation can tomorrow be the same tool that could be used for something nefarious. And we don't have easy answers right now. We just don't.
Obviously, America has been infamous in this pandemic. I often say that if this pandemic had hit during the Obama years when there was more international cooperation, you probably wouldn't have had a pandemic. But it hit during the Trump years, and America still leads the world in terms of cases and deaths. So I asked Michael Osterholm about the US situation, and here's what he said.
Well, I think this virus came into the United States through any number of different sources. Our borders, in a sense, were like a submarine with screen doors. You know, it was more than open to travel from any number of ways. As we know from studies that were done of the viruses first found in the United States, it's very likely it didn't come across the Pacific in any meaningful way in terms of entering the country here, but rather actually came via China through Europe and came in on our East Coast. But there were a number of points of entry where this virus arrived. And as such, it was here long before we recognized just how much transmission had occurred in any number of different areas in the country. We really were flying blind from January well into the middle to the end of March before we really got an understanding of just how much SARS-CoV-2 activity was in the country.
Just take us through how you got to the situation you got to with an appalling pandemic, with an appalling and scary number of deaths.
Well, I think first of all, you have to acknowledge the fact that this disease got politicized very early. It was an issue of where we had a federal government telling the public everything was okay, we had it under control, and there wasn't a sense of urgency. I can speak to that firsthand because our center, and I specifically, put out a document on January 20th of 2000 saying this was going to be the next pandemic. Wake up, America, and get ready to prepare for this. That was met pretty much with a thundering deafness. No one really wanted to hear about it. In fact, more often than not, I just got criticism. I wrote an op-ed piece in the February 22nd issue of the New York Times last year in which I repeated not only the call for America to understand the shortcomings that we weren't ready for this at all, but here we had the World Health Organization that still did not declare it as a pandemic till March 11th, still almost another 3 weeks later. And so I think the world was really asleep at the switch as to what this pandemic could be or what it would be. And then once that happened, we just got further and further behind. And I think there was this part of America that also said, you know, we're independent souls. We're going to do what we want to do. And we had a very, very poor response. Now, I have to acknowledge that, you know, we may have given up, you might say, as a public in doing the things that could help reduce the transmission. And meanwhile, other countries in the world, such as in Asia and even in Europe, after their initial problems really clamped down. But look today, particularly in Europe. Europe is really no different than the US overall at where they're at now. The only part of the world that has continued to sustain what I would consider important control of this infection has been those countries in Asia and, of course, in New Zealand and Australia, where we see it's not just authoritarian governments, but democracies can also control this. Now, people will argue, well, Australia and New Zealand are islands. Well, they had many introductions of the virus, and that could just as easily have taken off, and it didn't. So I think that one of the lessons learned was that if you, from the very beginning, had a plan how you were going to attack this virus, its early identification, the contact tracing, the quarantine, the isolation, and the willingness to do that, you could virtually control this virus infection. I just look no further than New Zealand and Minnesota, my home state. We have roughly the same size population. Minnesota has had almost 6,500 deaths. New Zealand has had 25. Now, is their science that much better? Not really, but their will to do something about it was. And I think that's a lesson learned, not just for this pandemic, but pandemics in the future too.
And just going back to that original discussion we had about the origins of pandemics and the multifactorial nature of them, I mean, America didn't do that well with the 1918 pandemic either. And isn't this sort of individualism that doesn't want to take community action, that individual freedom trumps, to use an unfortunate term, community action?
I think that's surely a big part of it. Also, I fear that there's a certain arrogance by us in this country that because we are the United States of America, we can't be impacted by an infectious agent like this. There was this assumption that we'll handle it. We know we have the most modern medical system in the world, or so we declare. You know, we think of ourselves as having the ultimate public health community. You know, the Centers for Disease Control and Prevention, the National Institutes of Health, worldwide recognized experts in these diseases. But what we didn't have was a real understanding of what this virus could do and would do in our communities. And as such, we weren't prepared. Our hospitals were not prepared. We were overrun with cases. We weren't prepared to deal with the social and racial inequality issues that furthered the transmission of this virus because of the kind of living conditions that many of these populations had to live in, crowding and a lack of access to health care. So I think that as a whole, this pandemic really shined a light on all the deficiencies of our country from what I would call both a humanitarian standpoint and a strategic standpoint of public health response. And we need to learn from that, surely. We are going to see it. I've been predicting that since January with the B117, and that is definitely happening. We're seeing it unfold right here in our own state of Minnesota right now.
When you look forward to the next 12 months. You've got new variants emerging almost spontaneously around the world, not necessarily, some of them are spreading, but some of them are just occurring, and very similar mutations because of the environmental pressure of immunocompromised people. Even partial immunization is the other issue that's going on. But you have got vaccination unfolding. What do you predict, given your predictions have been pretty accurate in the past, globally for this pandemic over the next 12 months?
Well, let me just say I have one disclosure I really need to make for this presentation, and that is I know less about this virus today, I think, than I did 6 months ago. So let me, with some real humility, tell you what I think very well will happen or might happen. Number one, we've been dealing with this now really for almost 14 months as a world population, this pandemic. But we've only been dealing with the variants for 3 months. We went along for many months assuming that these variants or these mutated viruses had no real significance as mutations, just the fact that we could identify them as being different. It was only really in early November we really understood that, wait a minute, these variants have other properties that are really significant. One, some of them are able to cause much more severe disease. Number two is they are also much more infectious. Or number three is that they actually can evade the immune protection from vaccine or from natural infection immunity. And once we realized that and we labeled these variants of concern, we began to understand this was a whole new ballgame, and that the variants were going to drive this pandemic in a way we had not appreciated. I just mentioned what's happening here in Minnesota right now. Well, it's beginning to happen around the whole entire United States, and that is what happened in Europe starting in November, December with B117, the UK variant, that is both much more infectious and causes more serious illness. And even though we have seen this great reduction in cases in the United States since January, and people feeling like, aha, we're over the hump, we're just on our way to vaccine, in fact, that's not the case at all. We're now about to watch a B117 surge occur in this country that could be quite devastating, even with the number of people who have been vaccinated and the number of people who have already been infected and have some protection. Now, fortunately, B117 doesn't evade the immune protection of the vaccine or previous infection, but just the sheer transmission issues are huge. So we're going to see another wave of illness here as we go into what will obviously be the months of the summer where we will have much more vaccine. But now you ask me where we're going with this? I don't know, because one of the things that we're confronted with are these other variants, the P1, for example, from Brazil, or the P1135 from South Africa, where there we're seeing the variants that actually can evade immune protection from vaccine and from previous infection. What's happening in Brazil right now with P1 is just devastating, both in not only the city of Manaus, which was the original location where we saw a big second wave of infection due to this new variant, which actually meant people who were previously infected got infected again. We're now seeing it in Sao Paulo. We're seeing it in Rio de Janeiro. So whatever happens with these variants could determine how well our vaccines or previous protection from having been infected will actually work. And guess what? We are concentrating on getting the vaccine to those in the high-income countries right now. Vaccine nationalism at its worst. And at the point right now, we may be able to vaccinate up to 20% of the low and middle income country populations over the course of the next year. Well, guess what that means? That means that the transmission of the virus is going to continue full throttle in those countries. That's where the new variants are going to spring forth from. And when they do, they very well could challenge how well our vaccines in the high-income countries work. So I would like to think that's not going to happen, but I have to say at this point, everything points to the fact that we are going to expect to see these new variants come forward. So we have to be very, very leery of assuming just because we have the vaccines we do now that we're done, we're over it. We may not be at all.
The next pandemic, which is really The last question I asked Michael Osterholm is, when and where does he think the next pandemic is going to occur?
I don't know. And I think that's part of the challenge we have today. Remember the last influenza pandemic in 2009 originated in Mexico after everyone assumed it would start in Asia. We're maybe not as surprised that we had the coronavirus pandemic start in China because, in fact, the concern had been there for some time about coronaviruses in animal populations in Asia. But, tomorrow it could start anywhere in the world for influenza, and another coronavirus could surely pop up, just like in the Middle East, where MERS, Middle Eastern Respiratory Syndrome, suddenly popped up in 2012. So I think it really is a global surveillance we need. Any day, anywhere, any place, it could happen. Our job is going to be early recognition and doing the most we can to try to contain it if possible, and if not, what else are we going to do than to try to protect the world?
Michael Osterholm, thank you very much.
Thank you very much.